Recording in progress.
We're going to start a little different in this snapshot. I want you all to spend a little bit of time before we jump into our content. Yes, we're going to get to our content, I promise. But I want you to get some water, so something to drink. And I want you to turn off all devices. And if you can remove them from where you are right now, just for this 10 minutes, okay? So remove all your devices. And I just want you to take a moment to reflect. Okay, so get water because we need to hydrate. If you're like me, rarely do I get a chance to just sit and reflect. Okay, so give me about 30 seconds. I want you to just sit, listen to the music, close your eyes if you choose. I want you to just take a moment to reflect. Okay, so I'm going to do it with you. I want you to think about everything you're grateful for, whatever that looks like for you. I'm going to sit still, listen to the music for about 20 more seconds, and then we'll go into our snapshot. Take a few deep breaths too. I know that's helping me center as our minds often wander. Deep breaths. That was harder for some than others. And take a sip of water, okay, as we jump into our content. Taking time to reflect, to hydrate, to just sit still, remove distractions is an important part of our work, right? Our work on ourselves. We have to start with self-care. You can't pour from an empty cup. And for many of you, maybe it's the beginning of the semester, depending on when you're watching the snapshot. Maybe it's the middle, maybe it's the end. Each phase of the learning journey has its own separate challenges. Okay, so what I want you to think about is what you're grateful for first. Okay, and then thinking about what is it that's missing. Okay, maybe you have a plan of what you're going to focus on and you get off track for whatever reason. Life happens. I don't want you to focus on that. In this snapshot specifically, I want you to be very intentional in reflecting on where you are today. Where is it that you want to get to? And how are we going to fill in that gap? How do we bridge that gap between current state and future state? Welcome back, everybody, to Dr. Sellars Educate. Our mission is simple. It is to support all nurse educators to achieve excellence. Now, for some of you, that's passing the CNE exam, okay, and we're excited to support you on that journey. For others, maybe you just want to become a better nurse educator. And listen, that's a great thing too. Our ability to engage better with our students in the classroom lends them to be better nurses in the future. I don't know about you, but I'm sure you feel the same way I do. When I look up, if I know one of my students have graduated or my nurse has graduated from my nursing program, I want to have a sense of confidence and comfort in knowing that I'm in good hands, right? So we each, every single day, can have a positive impact on creating that feeling for us, for our family, for our entire community. First step, just like we always do, is to go ahead and pull out that study worksheet. If you haven't already, print it out. We want you to write down two things today. Number one, what is your goal? Okay, what is it that you want to walk away having a better understanding about, knowing we're going to talk about change agent and leader? That's our theme for our boot camp. That's our theme for our snapshot. And then I want your snapshots over the course of the fall series. And then I want you to write down today's date, whatever date you're watching this snapshot. We want you to be very intentional in honing in on these concepts, focusing on your goals so that you can reach it and also have a little bit more confidence about your skills and your readiness to take the CNE exam as it relates to change agent and leader. All right, so we're going to go ahead and jump into our thought-provoking question. Just when you think you've turned all your notifications off, you get interrupted with notifications if you're like me. Okay, so make sure you turn your notifications off as well. Now, when you take a look at Billings and Halstead, we want you to focus on a few page numbers. Okay, we're just going to give you chapters, but you all know when you join Dr. Sellars Educate boot camp, monthly boot camp, or our self-paced course, or even our live review, you are going to engage in aligning your study plan and our conversation with the actual evidence, and that's Billings and Halstead. We're using the sixth edition. If you have the seventh edition, that's great. All right, so competency 5. What happens when you join our program? Then you're able to specifically focus on page numbers. But for purposes of our conversation, we want you to focus on chapter 27 in Billings and Halstead, sixth edition. After you're in the seventh edition, you're going to focus on chapter 26. Okay, so change agent and leader chapters to focus on, seventh edition, chapter 26. And if you're in the sixth edition, chapter 27. When you're enrolled in our program, you're able to specifically focus on concepts to help you close your knowledge gap so you're not spending time reading content that is not helpful. Okay, but we want to give everybody a good starting point. So that's where you're going to start with those specific chapters. Our content today is going to help you think about what you need to do differently as you're moving forward on your journey. Okay, for some colleagues, that means you need to first of all get the right resource. So that's Billings and Halstead. Don't waste your time on unnecessary resources. You want to make sure that you have the right resource that is going to help you close your knowledge gaps and clarify muddy points, right? That's our goal when you're moving forward on your journey. And then the second step you want to remember is we don't want you wasting time purchasing resources that are not going to help you. So I know you may feel like taking more questions is going to help you. There is no evidence that shows that that is true. That is true with NCLEX, but not on the C&E journey. Okay, so we don't want you wasting time looking at unnecessary content. So there's no need to buy any more textbooks other than Billings and Halstead. That is the requirement on this journey towards nurse educator excellence. Dr. Caputi's review book is optional. Okay. And then the second consideration we want you to think about is don't waste time and money on those practice questions. Okay. The only practice questions we recommend to align with NLN standards is going to be the self-assessment exam. Okay. That is published by NLN on their website. For some colleagues, we're here right now. I'm talking to colleagues at the NLN conference. For some of you that are here, we were delighted to meet you in person. For others, hopefully we get to meet you in person as well. Okay, so we are capturing this snapshot while we have so many great thoughts on our mind about change agent and leader. The theme of the NLN Summit this session has been, or this summit for 2025, depending on when you're watching this snapshot, is AI and how we have to embrace, I like to call it assisted intelligence, but we know the practical everyday term is artificial intelligence. So when we're thinking about how are we going to integrate some of the AI strategies that are evidence-based, what does that look like? Well, being a change agent and leader is part of that journey that we're talking about during the summit. We have to be able to lead boldly, just like Dr. Bev Malone talked about today, or we're going to fall behind. And listen, falling behind is not an option. We're all on this journey to achieve nurse educator excellence, and we have to equip ourselves with the knowledge as administrators. We have to make sure that our faculty have the resources they need to achieve success. So why? Why do we want to be considered change agents and leaders? Why is it that this is even part of the NLN nurse educator competencies? Well, that's a great question. And what we're focusing on is exactly what are those strategies that we need to partner with our colleagues at the college, because we're all leaders, to help our colleagues that may be a little bit more resistance to change than we are. How do we bring them along? What should that approach be? Again, not only for us that are formal leaders, but also all faculty that are informal leaders. All right, so let's take a look at our thought-provoking question. Students are struggling to stay engaged with simulation experiences, and faculty have voiced concerns. During the curriculum meeting, the faculty resist adopting a simulation-based curriculum, citing time limits and past experiences. What's the best change agent move? A, mandate training and work in small groups to move towards immediate adoption with deadlines. B, facilitate a listening session share evidence and pilot with one course in the next semester. Or C, invite a content expert on simulation and delay implementation into the next academic year. When you get to the C&E exam, you can expect scenarios or specific case studies that are going to really set the stage in that STEM related to the content that you're being tested on. Okay, so that's that level of application and analysis, just like with our students on the NCLEX. Well, NLN has also adopted that same framework. 70 to 80% of the questions on the C&E exam will be at that application and analysis level. So this is what you need to know. When you get to the exam, two questions I want you to consider. First of all, what is this question really asking me? Second of all, what is it that I know for sure about content related to this question? Okay, what is it that I know for sure? Number one, or what is this question asking me? Number one. Number two, what is it that I know for sure about content or concepts included in this question? All right, so stay with us. We're going to answer this question at the end of our time together today. So, number one, okay, we're talking about three strategies you can use to help you truly engage on this change, manage, or this change, being a change agent and moving forward on this change management journey with the faculty. Okay. So, number one, addressing resistance early. This is important. We know some colleagues have not adopted AI, they don't believe in it. Maybe some of them feel like it's cheating. Step number one, let's call it out. Let's have conversations, respectful civil conversations about the resistance that's happening. Adopting a competency-based curriculum is another great example. So, how are we going to move forward with that? Well, the bottom line is early resistance based on evidence. It often arises from fear of the unknown, or this is a big one, lack of input. I'm the first one to say, if I haven't been involved in those conversations, I have lots of questions because I'm an assimilator. This is Kolb's experiential learning theory that we're now integrating into our conversation. What does Kolb say? Well, Kolb assimilator learning style says, I'm very black and white. So where's the evidence to support this change? Number one. And number two, I haven't been involved in that change. So I'm going to have a lot of questions. And if I walk away with more questions than I do answers, then I'm going to naturally become more skeptical. I may even become more resistant because I haven't been involved. I have a lot of questions and I haven't seen the evidence. This is the strategy we have to consider when we are developing learning strategies for our students. They haven't been involved in the curriculum development. They don't understand the alignment between what we're doing in the classroom, the actual assignments that they have, and how it's going to help them become, first of all, pass the NCLEX. Second of all, become a safe practitioner, be able to make those safe patient care decisions using clinical judgment. So that's number one we want to consider is the fact that we all learn differently, we all respond differently to change. And so when resistance happens, we want to listen, right? I'm going to play that video again. Look at this great body language, right? The young lady in the red shirt actively listening. Look at that. She moves in closer, right? As she is giving direct eye contact. What else is it that you see? The signals that she's listening to the young lady in the white shirt, right? You can see that she moves in closer. You can see that she gives her direct eye contact. You can also see the nonverbals, right? She's smiling and she's clearly engaged in active listening, even when colleagues are resistant to the change, even when they have a lot of questions and maybe they're not listening. We still have a responsibility as a change agent and leader to be able to connect with what our colleagues are saying. And then, second of all, absolutely data, right? As simulators, we love data. Show me the data. I want to see it. So I want to build that trust, though, by engaging in this open dialogue. And then I want to share the data. I'm going to chart that out. I'm going to pull the data. I just threw up 3 courses for purposes of connecting with my audience. We want to leverage the data. If we know, as an example, there's a concept that students are not connecting with in pathoform and complex care, as an example, or adult health too, then you want to think about what specific exam questions are really validating student learning within those specific courses. And then maybe I want to see how the students perform for those specific items aligned with that concept for each of the courses. How have we threaded that concept across those three courses to ensure that learning has happened? Okay, so that's what we want to think about. What data do I have? How can I bring my stakeholders into the conversation, connecting them with the data, knowing that some of my leaders, some of my faculty in the room, they are going to want to see the data, right? Trust, but validate and verify. That's what data does for us. If we know there's resistance around a certain approach or a certain component of our plan, let's go ahead and pull the data. Let's have conversations. And if data doesn't exist, we want to be transparent and talk about what information, what research has validated the need for that change. We should absolutely have that. Even if there's no quantifiable data, we should have qualitative data. And of course, the sweet spot is when we have both. All right, so stay with me. We're on point number 2. Start small with pilot programs. I love a pilot program. In the clinical setting, that was my go-to. Every single time we implemented a change, I would say, okay, let's start on day shift as an example. Hourly rounding is a great one. And then let's move over to evening shift and night shift because we know every shift has its own challenges. Well, it's no different with curriculum. We know certain courses are going to be more challenging. There's going to be more opportunities to move changes forward within the curriculum for specific courses. And then other courses, maybe not as challenging. Good example is health assessment. Maybe it's not as challenging because there's no clinical aspect that we have to align or directly map, as opposed to foundations or fundamentals or adult health 1. There's a clinical, there's often a SAM and a lab. So it's going to be a little bit more opportunity, shall we say, to align and embed across a course like that, a clinical course, because we have more touch points. We have more specific programmatic outcomes and learning outcomes that we have to make sure align. So start small, and we want to celebrate those small wins, right? Because that's going to give us more momentum as we go. The third step. So, number 1, we talked about being clear about communicating the why. So, having the data, having conversation, right? Being open to listening and to engaging in dialogue with our colleagues. And then, number 2, as we just talked about, we're going to celebrate those small wins. Think about engaging in a small pilot program before we roll competency based out, is another good example across all of the courses before we map the entire essentials. Yes, that's a great goal, but let's break it up into steps, meaningful steps that we feel like can be specific benchmarks that will correlate with those early wins that we know are so important. All right, so step number 3, strategy number 3 is anchoring that change to specific outcomes. So alignment is key with our program goals, with our faculty and our students. And of course, when we can engage with early adopters to be change agent partners along with us, that's a win-win. If we have students, if we have faculty that can truly partner with us to move those changes forward, we certainly want them at the table. So what does that look like? What are some of those examples? First is going to be student achievement. So the positive impact that this change is going to have, let's talk about that. Let's focus on that with our students. A good example is when it comes to the NCLEX blueprint. We all had to make changes within our nursing program to align with that NCLEX blueprint. Some students may have felt that change more than others. And so we want to talk about that in a transparent, meaningful way, right? We don't want to go deep into academic terms, but we want to talk about something very basic. You know what? Our goal is to help you pass NCLEX the first time so you can get to work as quickly as possible. And then when you get there, we want to make sure you're able to make those safe patient care decisions by integrating the clinical judgment model that evidence shows is going to help you be more impactful and more competent in providing safe patient care. Okay, so just think about what's that language that we can use with our students to help them celebrate the wins and understand this journey that we're moving forward on. Faculty development. We want to bring along our faculty, the naysayers, those that are going to be more resistant to change for whatever reason, right? That change is hard for even the most positive, optimistic human. So let's be transparent, let's be collaborative, let's partner with all of our faculty colleagues to move the change forward. And then third of all, of course, is focusing on improving improving program outcomes. So let's be specific for our leaders in the room about the why and how it aligns with programmatic outcomes, better alignment with CC&E standards or ASIN standards. Also thinking about our long-term goals of increasing our NCLEX pass rates, even increasing retention of our faculty and matriculation and increase in persistence rates with our students, for our students. So just thinking about those specific improved outcomes. All right, so stay with me so we can debrief with our thought-provoking question, the answer to that, and now we're going to debrief to recap the top three. So top three strategies you want to use, address related to change that we know is inevitable. I say if we're not changing in nursing education, then we're not truly serving. Okay, again, if we're not changing in nursing education, we're truly not serving our community to include our students, our patients, our healthcare partners. So addressing resistance early, I know it's easy to keep putting it off, but that doesn't create a win for anybody. We got to do the work, do the evidence, look at the evidence, bring that forward, have conversation. Step number two, start with the small pilot programs, right? Celebrate those small wins, bringing our students along, and then anchoring in our why, being clear about our why and communicating that in a meaningful way to our stakeholders, our students, our faculty, and ultimately making sure that it aligns, that change aligns with the programmatic goals and outcomes that we have identified for ourselves in the nursing program. All right, so you made it. You made it to the end. We started with self-care. You engaged with me. Thank you very much. And some deep breathing, hopefully, taking a moment to reflect on gratitude and what we are all so grateful for. Taking a moment to hydrate. Self-care, we know should be a priority, and it's really important for us to be our best self. So if you chose, this is where we celebrate, B, give yourself a round of applause, facilitating a listening session, share evidence, and pilot with one course in the next semester. We're going to debrief about why. Here's the reality, though. I think these distractors, which were A and C, were pretty good. We tweaked them quite a bit. So I expect that some of you may have chosen A and C. Okay, so let's take a look at A, mandate training. Is it always the best strategy when it comes to change to mandate training? That may be where we have to get to, right? That may be an unspoken rule, but by saying from the very beginning, mandate training, that gives us a little pause, or at least it should. So some parts of a work correct, working in small groups, that sounds pretty good. But then it talks about immediate adoption. Well, that's not necessarily true. We want to have deadlines. We want our colleagues to adopt them. But whether or not it's immediate is probably too early to tell, right? So that's why we would have a little bit of trepidation and pause about A. And then take a look at C, invite a content expert on simulation. Well, that sounds pretty good. But think about, what is this question really asking me? It's about the best change agent move to take. Delaying implementation, we don't want that because we've realized there's a problem, right? There's resistance, faculty are concerned, students are not doing well, so we have to think about making a curriculum change. So as you debrief and think about what attracted you to A or C, if you didn't get the correct answer, this is the reality. We want you to celebrate no matter what. When you're looking at these thought-provoking questions, whether they're with us or the practice questions in Dr. Caputi's review book, we want you to celebrate every single time you choose the correct answer, yes, and we want you to celebrate if you aligned with the rationale for the incorrect and correct answers. So B actually models collaborative leadership, reduces resistance, and create quick wins. A increases pushback, right, because you're mandating training, and C stalls what is a necessary step in moving those changes forward, that needed progress. So how did you do? What's your number? How do you feel about the content that we've discussed today, aligning with competency 5? So 1, you feel lost, or 5, you feel ready to teach. 4 or 5 is that sweet spot. If you're a 3 and below, we want you to identify what specific concepts were a muddy point for you. And then we want you to take a look in the chapters that we mentioned earlier. If you didn't catch them, go back and listen at the beginning. But we mentioned 2 chapters that's going to help you close your knowledge gap. And if you want to go deeper, and you want to maximize your study time, then join us. We have a monthly boot camp. We have our next CNE in 60 days that's coming up soon. So go to our website to find that out. And then the third step we want you to take is to congratulate yourself for showing up and staying to the end. Our ability to be our best self starts with us reflecting, thinking about how am I going to be better for myself? Because in turn, that's going to help me be better for my students. Thank you all for taking time to pause today, to reflect, and now we want you to act. Okay, so act means that it's not just about showing up here, having a great conversation with us, going deeper in these concepts that we talked about. We want you to also think about what can you do in your curriculum to improve the behaviors that not just you are demonstrating to align with NLN educator competencies, but how can you share that with your colleagues? We look forward to seeing you next time, or you can head over to our website and find out about upcoming programs. We look forward to seeing you the next time. Take care, everybody.